Hello, everyone. I'm here today with a bit of a different approach in speaking about the virus. Today, I'll tell a bit of a success story, um, more specifically, a lockdown success story coming from the great state of California, which had the strongest and longest uninterrupted lockdown measures, confinement in the state, out of all the states in the United States, probably with the state of Washington, but definitely California is one of the states where the lockdown measures were the strictest, and that went the longest without interruption. In some cases, some counties, lockdowns were never taken aback since March. So I'll read you this article coming from the New York Times of December 17th to 20. So taking into consideration that California has had the strictest lockdown measures in the United States. So now let's get into this success story of a lockdown. As California ICUs fill up, the dead are counted by the hour. Just 2 weeks ago, Governor Gavin Newsom warned Californians that the state's intensive care beds might be full before Christmas. Now it appears that dire projection is being borne out. How bad is the coronavirus surge in California? In Los Angeles County, officials say an average of 2 people are dying every hour, and 1 in every 80 people there is thought to be infected. Our hospitals are under siege, and our models show no end in sight. Dr. Christina Galli, the Director of Health Services in Los Angeles County, said Thursday. Statewide, California reported 3% availability of ICU beds on Thursday, but the problem is most severe in the southern part of the state. Within the month, Dr. Galli said the number of patients requiring ICU care in Los Angeles County could easily exceed the 2,500 licensed adult beds by 1,000 or more. California continues to shatter records. More than 45,000 new virus cases were reported on Thursday and 260 deaths. But it's hardly alone. More than a third of Americans live in areas where hospitals are running critically short of intensive care beds. Federal data show. A recent New York Times analysis found that 1 in 10 Americans across a large swath of the Midwest, South, and Southwest lives in an area where ICUs are either completely full or have fewer than 5% of beds available. The total number of confirmed infections in the United States since the pandemic passed 17.2 million on Thursday, just 5 days after eclipsing the 16 million mark. There were over 238,000 new cases and over 3,290 new deaths reported, making it the second worst day of the pandemic. In California, the authorities have ordered an extra 5,000 body bags, activated a mutual aid network for morgues and coroner's offices, and stationed 60 refrigerated storage units in counties around the state to handle remains. Health officials in Orange County said they would roll out 3 field hospitals. Hospitals are particularly overwhelmed in San Joaquin Valley, where many low-wage essential workers live without good access to health care, even in the best of times. The number of available ICU beds there hovered at 0.7% on Thursday. Even the Bay Area, which for a time managed to stave off the worst of the surge by adopting an especially conservative approach to reopening, has not been spared. ICU capacity there has dropped below 15%, leading to a new regional stay-at-home order. The ever-climbing numbers are all the more demoralizing for Californians because they have endured some of the most stringent pandemic restrictions in the country. But now, more than ever, health officials said they need to keep hunkering down. It's going to be a wild ride, probably for another 4, 5, even 6 weeks, said Dr. Nancy Jin, a regional medical doctor for Kaiser Permanente in Southern California. She urged Californians to stay home and not give to temptation to travel as the holidays near. The advent of vaccinations has buoyed people's spirits, but many healthcare workers are exhausted to their core. It's really hard to put all of this into words, said Helen Cordova, an ICU nurse who was the first person in California to receive a vaccine shot. This is a very real disease. Those images of inside of hospitals that are very accurate. So, this was a success story of California's lockdown measures. A recap, you can say. So now let's go check some of the numbers of the states with no lockdown measures and that refuse to close their small businesses. Like, for example, Texas and Florida. So, as of yesterday, California has 1,809,585 cases. That jumped from 48,500 the day before. They have 22,436 deaths. That jumped by 286 from the day before. Now Texas, 1,571,925 cases. That jumped by 19,376 from yesterday. And 25,608 deaths. That jumped by 272 from yesterday. And Florida, who has 1,181,475 cases. That jumped by 13,000 yesterday. And 20,400 deaths. That jumped by 96 yesterday. So, in Texas and Florida, that even have that are even accepting people at their football games, have drastically less numbers than California, who are in dire lockdown. So as you can see, cases jumped by almost 50,000 in California, but they have been in lockdown. Well, we can say the strictest lockdown, the latest lockdown, coming from the LA Times of November 23rd, 2020. New California COVID restrictions met with skepticism. Or from the same newspaper, LA Times, on the 2 days before, on the 21st November, California sets curfew as LA careens toward COVID lockdown. Then we have over here Bloomberg from the 4th of December. California lockdown rules for the Bay Area. And finally, The Guardian of 8th of December 2020. Fatigued Californians are back in lockdown. So even though with these strict lockdowns that California has, they still manage to get more than double the new cases a day that no lockdown Texas and Florida have. Well, actually, Florida is even more, like 3 times the number of cases, and they have almost 3 times less deaths. Something needs to be said about that. Lockdowns really work. I don't know because I'm not a specialist, but looking at these numbers, I can assume that lockdowns are not working. If we look at what experts, in air quotations, were saying, that after Thanksgiving, cases were going to rise because Americans don't care, and they were going to gather anyways for Thanksgiving. Well, if we look at the Midwest states of Kansas, Wisconsin, and North Dakota, which all had different lockdown measures, some more strict, some less strict, and they all mysteriously saw a descending trend in their COVID cases curb after Thanksgiving. After November 28th, cases are starting to go down no matter what the restrictions are. So can we say, or can we speculate that the virus is more of trendy virus, if trendy is the right word, or a seasonal trend in the cases? Because like we saw in the spring, most of cases where that it went up for eight weeks and then stabilized for 2, and then the next 6 weeks it went down. Well, we're kind of seeing a similar trend in the second wave, just in shorter lapses of times. Meaning it rises for a bit less of time, doesn't stabilize that much, and then a few days later starts going down, no matter the restrictions. So the question can be asked, do lockdowns work? I think we've had enough time since COVID hit to examine these things. Studies, I'm baffled that there's no, well, at least that I could find, academic literature studying how the virus spreads. Not saying physically, like by aerosol or by surfaces. I'm saying the periods and times where cases rise, stabilize, and then go down. We have enough statistics and data to see these things, where we could actually after realize that lockdowns don't work. Not saying nothing against the measures, washing hands, the social distancing, the 2 meters, all that. Try to stay away from vulnerable people. Those things are all important. Wear your mask indoors where you can't keep your 2 meter distance. Those things are all important to slow down the spread. At least in my opinion. As a normal citizen. My humbled opinion. But there's definitely data out there that allows us to question strict lockdown measures. It's as simple as that. I'm asking the question. Don't come at me. But the question should be asked, and we deserve answers. Don't you think? Thanks for listening. See you soon.